going to be more government interplay, more mergers, and diversification, and the change of the market is a lot of tension. What you have to do as an industry is find your relevance, find your niche, endure. That's going to require technology, innovation, modifying your program, your operation, and doing that with as much scale as possible. Workforce problem, I see it starting to get understood a little bit more, which is nice. Increasing prices isn't going to solve the problem. We are not going to have enough people to fill the positions.
How did you begin your journey, in home care, and how did you get drawn into this new world? Probably, I don't know how many years back was it. Something that influenced to that a story that you want to share with us and our audience that brought into this, and then how you became pretty much a leader in many ways to influence this industry.
Yeah, I can start, as I feel like it's going to be a lengthy answer, so I'm going to try my best to keep it short.
Sure.
I was first introduced to home care at a very young age, the earliest years I can remember. My dad worked in the disability industry. My mom worked in the senior care space. And they're actually, when they got married, they both had a job together in an institution out of Nebraska. And this is before I was alive. And so they went right out of their first college days into the same job at the same institution, and would share stories about how they were just moved in a way to make life better for people with disabilities. They saw the lived environment, the facility environment these people with disabilities were living in, and knew things could be better. Fast forward, they moved to Arizona. My dad started working for the state, and my mom also in the industry. And before long, my dad was actually one of the leaders that helped establish the Medicaid waiver for Arizona, and opened it up where there was an open vendor call for companies to come in and apply to become a vendor to provide home and community-based services. And this long-term care back then, and nobody was applying. And so my dad went to my mom, who was an executive level in a pretty large scale senior living community, and said, well, let's quit our jobs. My dad was an executive level at the state, and let's start a home care company. Nobody's applying. And I was, again, very young at this age.
This was in 90s or early 2000s?
Gosh, probably 80s, late 80s, early 90s. Because our waiver, I think, was established in like 1986.
Wow.
So they quit their jobs, took a leap of faith in this area of work, and started one of the earliest home care companies in the state out of our home. So I was one of their early unpaid employees that helped stuff envelopes Friday nights while eating pizza. And it grew. And I remember it growing till they had a staff in our living room, and then they moved into their first office, and then they moved into different territories of the state. And then it grew and grew and grew and grew and grew. But I always just remember having people from all different walks of life in our home at holiday parties. I remember being entertainment for senior living groups, and I'd go in and do art projects. It was just always part of my way. And so fast forward, I graduate college. My parents they were planning to sell their company because it was at a scale they didn't feel like they were able to manage the quality more. They wanted to slow down. And they said, do you want it will keep going if you would like to take over. And my sister and my sister is an artist, a fine artist, and my sister's like, yeah, no, I'm good. And I want to do my own thing. I want nothing to do with what y'all do. I'm gonna become a traditional corporate America person and do my own thing. And got my first job in public relations, and did that for about 3 years before I just I wasn't happy. I wasn't loving my job. I got to go to fancy parties. I got to, do all these fun things, but it wasn't my calling. And I found myself gravitating towards these nonprofit mission first clients. And then I was invited, when I was kind of getting the itch to move on, invited to join the CMS New Freedom Initiative grant project, was in partnership with the state and another large agency at the time, national agency, and to be the project manager. And this project would help stand up home care companies that would be owned and operated and governed by people with disabilities. And it was emphasizing self-determination and self-direction. And so I did it. I said, yep, let's do it. I started under the grant. That just kind of grew. And under that grant, we formed multiple different organizations. I took on executive leadership role, became a CEO. That then grew. And along the way, I met some of the most amazing self-advocates and family advocates. Their stories were inspiring. And to witness how they would overcome what is seemingly a big burden just to do everyday living activities. And I could never wonder or grimace at the fact of just getting up out of bed. I was so inspired by people carrying out and doing amazing things in our community. And I have no reason to complain. So my job, and I'm motivated to be that instrument, to be that tool, to be that resource so that I can help someone else live their best life. And that helps me feel like I'm being the best version of myself in turn. So it motivates me. So yes, these advocates I got to work with have kind of motivated me along the way. Over time, I established enough of a name for myself. I was invited by our safety net hospital system to take over their home care product, that because it was under the state, they couldn't afford it any longer because it was a government entity. And so they asked if I would take it out, separate it, establish it as its own 501c3, establish new contracts with our managed care plans, established a new contract that didn't exist before with our IDD program, and then expanded to private duty services, community health work, and we've just kind of grown since there.
Wow.
So that's my long story. You
Wow,
can cut it down or chop it up.
Yeah, but fascinating story. So the Home Assist brand was your parents' brand too, or it's a different brand when your parents ran?
So
It was a
I
different
never
brand.
took their product.
Oh, you never took their
So
product,
they
but this is a
sold it
totally, they sold it, but then
because
you
I
did
decided
establish
not
this
to.
brand.
I wanted nothing to do with theirs, so they sold it, and then I ended up doing the same exact thing that they did, but without their original
But then
product.
they must be very proud of you, Sarah, for coming
I
back
hope so.
and full
Yes.
circle. Though they may say that, oh, you didn't take over what we did,
Right.
but it
Yeah.
came full circle, coming back to
Yes.
where they wanted it. So the vision
Yeah.
was fulfilled.
And I'm stubborn enough that I couldn't do it their way. And
Right,
so
right. So I'll actually give a very relevant quote to this story also.
yeah.
There is no place like home, and it feels good to leave and
Yes.
feels even better to come back home. And that's
Right.
exactly what happened with you.
Yes, it is. I left for a little bit. I was like, oh no, no, no. I'm ready to go back.
Right, right. And I think that's where I think it's happening with our kids too, right? So
Yeah.
when my kids left for college, they feel independent, and they feel so they get the freedom, but then they start going work. When they come back home, they feel that they feel good. That the
Yes.
mom's cooking and all the
Uh,
all the pampering that we do again, right? So
mhm.
it feels better always to come back home. And that's
Yes.
exactly the story that we are extending, and you are extending. Running an agency is for the elderly,
Right.
for senior patients, senior population in Arizona.
Right.
They will never feel better in hospital system or another
No.
facility.
No.
They always want to come back home.
At home.
And
When we do services, and these are, and they're all inspiring stories. There's not just one. Where recently did a home tour visit with Senator Sinema's office, and
Mhm.
this one individual that's part of our program is very active in his community. and he goes to work every day. He works for Bank of America, and he's able to live in his own home independently with the support of a direct care professional who goes in and does supports in the morning, does supports in the evening. He's got a significant other, and the significant other can be his partner in life, not his caregiver. They can keep their relationship intact. He can stay an active member of the community. And I think that gets lost too often, that sometimes the people that are all around us working in jobs here and in different businesses are sometimes using care at home so that they can go to work. If these services weren't there, we're going to lose a margin of our workforce, not just those ones who leave the workforce to take care of grandma or grandpa, but those that are working with a disability. We'll lose those too, because they'll end up in, an institutionalized setting where they can't go to work every day.
Absolutely, absolutely. Well said, Sarah. So now I'll turn to Sarah. Now some of the challenges that agencies are facing, including yours, uh, where there is regulation coming in. There is one challenge on the recruitment side where you are still, we see post-COVID, right? Big challenge of workforce leaving the healthcare world and pursuing other jobs. Uh, and then also the challenge around the government coming in with their regulatory changes, which is impacting the agencies from a cost perspective, right? So both ways, you see that even if you hire caregivers, they come at a higher cost, but at the same time, the funding that you're supposed to get, it's not there yet to run a profitable or barely profitable agency. How do you see this? How do you see this transition happening in the next couple of years, where at the end of the day, you need to still run an agency, big, small, or large, but at the same time, like you said, this care should not be impacted. The home care world should be intact, sustain, and grow. And then you know that the population is going to get doubled, 65 and above, in the next, I don't know, a decade or more. So there is going to be a huge storm. Especially, I was hearing that the Vietnam veteran population is going to come uh, in a huge way. They're going to qualify the 80 plus, I think, criteria, and there's a huge population just in the veteran side. So how do you see this home care world going through a transition from now to the next year or two?
I have two perspectives, two different views on it.
Mhm.
One, when you look at an industry life cycle, and I think you're probably aware of this, and most anybody else would be following this story. We're at that phase in the life cycle of a shakeout, right? We're clearly at a point where the market's going to be changing. There's going to be more government interplay, more mergers, or actually those are starting to get into this wonky place because of the fiscal conditions. But more consolidation and diversification, and the change of the market is happening right in front of us, which creates a lot of tension, and it will weed out some of the market players. Some people will go away. Some people will stop certain lines of services. So I think, and that's part of why you get that term shakeout, right? So that's going to happen. That's just part of the life cycle. What you have to do as an industry is find your relevance, find your niche, find how you endure. That's going to require technology, innovation, modernizing your product to meet those changing dynamics, whether it's with the government, the funders, and the population. So that's going to be the people you serve in your workforce. So if you are working with those, changing within those considerations, I think you'll come out surviving. If you only focus on one of them, if I only focus on government, if I only focus on financial, if I only focus on employees, I'm going to lose out. You have to be taking all of them into consideration, modifying your program, your operation, and doing that with as much scale as possible. Keeping in mind that on the second side is the workforce issue. You could talk about demand all day long. I have no issue with getting a call from somebody who needs services. The workforce problem, I see it starting to get understood a little bit more, which is nice because for a long time, and we still call it shortage, but I think there's some growing understanding that it's not a shortage issue, it's a scarcity issue. And how you solve for shortage is different than how you solve for scarcity. Again, it goes into collaborating with the government, your payers, and your customers, and your business. So you have to approach a solution in a different way for scarcity than shortage. We can have all the demand we want. Increasing prices isn't going to solve the problem. We are not going to have enough people to fill the positions. So that goes back into innovation. So, how do we use technology in a way that augments our authentic intelligence and allows people to work more efficiently? I should change that to say effectively. Let the systems be efficient so people can be effective. And when you allow people to be effective and you're a good employer, people are happier. If they can be effective, they see their work doing what they were supposed to do. If I took a job here, and I know I'm kind of going quickly and I hope it's coming together. If I took a job here at Home Assist Health to be in our program department and I'm spending 50% of my time on administrative tasks, I'm going to be unhappy. I want to spend 75 plus of my time in being effective under my job description, not documenting, not trying to figure out how my system runs, how to do a report, what are my census numbers, what are my billable hours. That is not what I signed up for. So we need to use technology, innovation to allow people to be effective in the job that they were called to do that serves their purpose. When you do that, people will want to work for you. And then if people want to work for you, then you're going to have a happy employee and a happy client or customer or member. And so, and then you're going to have the payers because they want to be happy too. So I think it's just how you approach it, but I definitely think it's not as simple as solving for shortage where you just increase the prices and you'll get the workforce. The other way to put it, which I really loved out of a book that I read called The Autonomous Organization by Philip Bredsgard, and how he positions it in his book is people either you either inspire people to work for you or you manipulate them. If somebody's willing to leave your company for an extra $50, they're manipulated. Good
Mm.
leaders inspire you to work for them and they will not leave your company for an extra $50. So it kind of makes you think about everything. Again, if you're effective in your role and you're happy, you're more likely to stay. Um, so I kind of covered it. This is why it's good I didn't write it because this is probably a lot of words, but I hope it condenses down well.
No, I think that is you said it very well because you made a distinction between efficient and effective.
Yeah.
So that is, I just caught my attention with your quote also from the book, where you really qualified it, saying, and it happens in our personal world also, right? It's like at the end of the day, whether you are an agency owner or an employee, part of staff, or a caregiver, or a patient, right, or a client, right? What motivates you? What
Right.
motivates you is not money. It's motivates you is that touch,
Right.
that passion, compassion that you show.
Right.
It's part of the care cycle also. It's part of also employee engagement.
Hmm.
If they are happy doing what they do, um, in whatever role across the life cycle,
Right.
like you said, I think they're going to be you're going to get the same. You're going to get the results in terms of
Yes.
sticking with you from a retention standpoint for an employee,
Yeah.
and then also the client is going to stick with you
Yeah.
because you provided the care in a compassionate way
Right.
in the long run. So
Yeah.
I think you would, yeah. Sorry, go
Good.
ahead.
And I want to touch on one last thing real quick because you talked
Mhm.
about the demand. One thing I think home care operators and businesses need to be mindful of is the role they can play in being a proactive partner in mitigating the growth and demand. Um, for just to be more specific, we know that our working aged adults, those who are 45 to 65, those are our primary caregivers, those are primary workforce. Um, they are also rising in rates of chronic disease that are taking them out of the workday, more sick days. They're taking them out of workforce at younger ages. So if we're worried about workforce, then we have an opportunity to also be a proactive partner in helping people live healthier lives. So looking at your care model, what are you doing to help people understand healthy lifestyles? If you're in a home where there's diabetes, doing diabetes education, diet compliance, med compliance, what role can home care do to help mitigate some of these workforce challenges by being a proactive health partner? And that kind of goes a little less in terms of tech innovation and more of a modern take on program delivery.
Yeah, absolutely, absolutely. So I think you touched a good point there. I call it as, or I heard some a word called sandwich generation, right?
Yes.
So the sandwich generation applies to both your workforce, as well as the caregivers, as well as the client population, right? They
Yeah.
are torn between taking care of themselves to taking care of others. I would say, as I don't know what we call it as. Are we millennials, or are we?
I
No,
don't
we
know
are not.
yet.
No, no. Uh,
I don't categorize me, but I thought
yeah,
that isn't sandwich too. You've got you're raising young children still, and then our parents.
yeah, yeah,
So our
exactly,
parents need something, and I still have my kiddo. But then you're
exactly.
right. Now I'm neglecting my own health. I'm not going to my doctor's appointments because I'm busy doing moms and childs, and I'm not taking care of myself.
Exactly, exactly. So in that process, right, let's say if I have to quit my job to take care of my parents, then I'm losing my career opportunity.
Right.
So I would rather put them on home care services
Right.
than I quit my job, which is already paid for, uh, or partially paid for if it's not fully private pay.
Right.
So I think that's where, and you said you make your individual choices for career as well as your personal choices because you have your own
Yep.
family to take care of. Now,
Yes.
touching on technology, Sarah, I know you touched a little bit
Yeah.
here and there, and I want to expand a little bit where technology is taking and making the disruption, or at the same time the innovation, right? So, as an agency owner, how do you see technology impacting the effectiveness of the employees to also the care, right? Because the technology come in many ways in the life cycle of an agency.
Hmm.
Initially in the intake of both caregivers, and also in the intake of the client community through referral process, to the engagement cycle, right? Where you're engaged constantly, where your back office has to follow up for different things, like the EVV bot does for curating the shifts. That is the engagement cycle. A welcome message, nice welcome message, which is automated. Which, to also at the back office side, where you want to make sure that you get the billing and the claims and the denials or whatever, right? So make sure the back office, because you still have to continue get constant cash flow to sustain to run your operations, because you have your own operational costs. In these three areas, where do you think technology is going to make the
Hmm.
biggest shift, or relative biggest shift, or where do you think the innovation should happen further,
Hmm.
that which will benefit you? I think you use Pocket RN, right?
Hmm.
Briefly, I've seen you reference that, or other technologies that like ours. But where do you think the home care agencies are looking at technology to help them? One is, we as technology owners, we try to impress upon saying, hey, we have got this, we've got this, we've got this. But then you're looking at, no, that doesn't make
Hmm.
sense. I don't think I
Yes.
want to invest in that area. If you have to
Hmm.
pick top two, top three areas
Yeah.
where the ask for you is technology can make an impact.
Yeah. So I'm going to start my response with framing because
Sure.
I look at, I am not technologically inclined. It is not my comfort zone. So, and if AI and all this tech stuff started coming out, I just like, whoa, what are we talking about here? Um, And I, with that same perspective, I greatly appreciate intuitive technology. I loved this. Who was it that said it? Was it Jobs that said a computer or your internet should be like electricity? You turn on the light switch and the room lights up. You don't need to know how it actually got into the room. You don't need to know all that. I love that because otherwise I confuse. Don't I have no clue how? So I love and I appreciate it. I don't fully grasp it. So I appreciate those minds. That said, also, I'm very person first, person centered minded.
Yep.
Technology has to somehow, as I said earlier, augment the authentic intelligence, which as you probably heard, authentic intelligence are human beings, people that can work in open systems, dynamic, creative. So how does technology augment that authentic human being? And I see that in a couple ways, just to make it, for me in my space, I see that as I know some folks that have really cool artificial limbs that are remote, or they can do a augmentative communication device with their eyes and they light up different letters and it talks for them. I've seen technology do incredible things for people living with varying degrees of disabilities to help them be the most effective, fulfilled person that they want to be. When I look at it as a business owner and operator, I'm looking at technology in the same light. How is the innovation or solution going to help my employee, if it's a supervisor or coordinator, how are they going to be most effective? So the EVV bot, my team hates getting stuck behind a computer and a phone, making 3, 4, 5 different calls just to clean up a schedule when they can be doing a visit, when they can be scheduling and doing a care intake. That is an example of how I can help them be more effective. I think reducing the burden on our program care staff is top tier, most important. I really value, systems around the billing process, the payroll process. I do feel like we're a lot closer there with technology and streamlining the AR and the payable process than we are on the care process. So my preference and my focus is really on cleaning up and tightening up and automating care and the care cycle, life cycle from intake to discharge, the reports, the tracking of data and outcomes. That's where my preference would be. One of the partners that we are working with is Ella from Taproot.
Mhm.
And it is an AI solution that focuses on dementia care and other TBI or other cognitive disabilities so that the care provider can go into the app and note what the behavior reaction rather is. So mom's refusing to shower 5th day in a row. Type in the reaction that they're getting, then the solution is going to come back with um, after reading the EMR, the backstory of the given client and dementia practice, and give a solution right then and there so that the caregiver can say, oh, I'm going to do this as an intervention to
Interesting.
move to the desired reaction. And then it captures the data on what worked and what didn't work. And then we'll continue to provide future care teams. So if your care staff changes, they will already have that intelligence built into their care plan. When you go to Mrs. Roberts to help her shower, play this music, say these words, give her 5 minutes. It'll give her the strategies to have the positive reaction you want. That's all AI. I can't expect all of my staff, all of our care pros to go through a dementia training class, to go to autism training class, to go to behavioral health, right? But I can have them, their talents and their authentic intelligence supported and emboldened with artificial intelligence that does this for them.
Very interesting. Very interesting. I like the way you changed the word AI from artificial intelligence to authentic intelligence. We don't want intelligence to be artificial.
Right.
We want it to be real. We want it to be real. We want it to be
Yes.
authentic, which
Yes.
touches a human life
Yes.
from an experience standpoint, right?
Yes.
So that's very well said, Sarah. Uh, uh, Now I'll go into into a story, right? So uh, if you have to tell a story in your organization, which I know you told a little bit of story early on, but in your agency, which touched you from recent past that you want to share, could be for a patient that you served, or a family, or within your family or outside, that was part of Home Assist, that you want to share with us. That'll be interesting to know, if that comes to your mind. Yeah,
I have trying to narrow them down. I've got
sure.
two people that were very inspiring to me, and I consider them some of my early mentors. And both of them were fierce, incredible self-advocates. And I learned so much from them in my first 3 years of entering this industry professionally. One, and this story is actually captured in the news from, he used to be a former chairman of mine in my past life, and just amazing individual. He was a baseball player, Scottsdale Community College, with aspirations to go to ASU and play baseball. And
Mm-hmm.
he was in his apartment, went to bed because he had early practice in the morning, and his roommate happened to get access to a firearm and had a friend over, and it went off.
Oh,
He was
okay.
awoken in the middle of the night thinking he had a heart attack, but the bullet had gone through his room and through his spine. When he looked down, he saw there was blood, and he realized it wasn't a heart attack. The roommate and the friend came running into his room, and one had fled, another called 911. He was taken away. They stabilized him. He was transitioned into a nursing home ultimately, stayed there for a few months or a period of time, thinking this is it. This is my life. I'm a college aged kid in a nursing home. And he said a little old lady came wheeling up to him and said, "You're too young. Get out of here and go to school." So he said that was his moment where he was like, she's right. He made arrangements with his mom and his dad to move home, establish accommodations, accessibilities in his home, get a caregiver, access resources that were available in the state, and went to ASU and graduated. He went from there and became a huge advocate for the state of Arizona. He influenced the Arizona Department of Transportation on bus safety, curvatures in sidewalks, stoplights. He was awarded a Leadership of Excellence by Robert Woods Johnson Foundation. Um, and he's been a youth mentor for children or young adults with new disability. And so just an incredible pillar in, I think, not just our community and our state, but within the industry. And those are the stories. And I know it's not somebody we necessarily care for every day, but that's why I do this, right? Like that, these are incredible people that we all have a disability at the end of the day. You wear glasses, I wear glasses. So
Yeah.
technically we use DME, right? We
Yes.
just use them to a different degree. So, and then to the other end of the spectrum, we care for a sweet woman who bought her first home at the age of 17. She's now in her 90s, and her wish is to live in her home from 17 years old until her final breath. And her
Wow.
family has wrapped around her in that wish. And because of Care at Home, she's able to fulfill that dream. And so, from every end of the spectrum, fulfilling your greatest potential at a young adult, college age, all to a professional, to your final days, you should be able to live in the least restrictive environment, whether it's through healing, recovery, or age, and be where you want to be. So that's what though all those stories I get fuel my purpose.
Wow. That's amazing. That's really amazing.
Yeah, it's fun.
That's fantastic. And I've seen that, with my parents and my grandparents also, right? They're so comfortable when they're at home. And they will serve themselves. They'll cook themselves. They'll say, "Don't take me anywhere. I'll take
Yeah,
care of
right.
myself." They tend to say that.
Yeah.
They're always in denial, saying, "No, no, no, I don't want to go." So if they get that healing touch,
Yeah.
their mental alertness, physical alertness goes up automatically.
Yes.
So and And I like the way you also correlated that story to wearing glasses, right? So I
Yeah,
just realized that I also
yeah,
have a DME.
you do. Yes,
So so
you
so
do.
and
We
I was in
all
dinner.
have it. Disability. It's a different degree in which it affects our activities of daily living.
Totally, you changed my perspective with that one statement that we think we are very normal people, and then we are wearing all these devices already. You know,
Right.
even having an what is that Apple Watch, right? You are wearing
Yes.
a DME because you're trying to you're
Yes,
check
it's a
your
monitoring
check
device.
your monitoring device. So
Yeah.
that's a modern way of thinking that
Yeah.
we are all going through some disability in one way or the
Right.
other. It's just that the level of it could be varying, and how we can take care of ourselves in different
Yeah.
ways, especially being at home. One final thought, Tara, that was a fascinating story. One final thought before I know I took enough time on a Friday
Yeah.
afternoon, but I just want to wrap up. Now, if somebody wants to start a new agency, right, with your experience, what advice do you give? Because I know in my friend circle, and also we are going to these events, right? There are newbies who are coming in with one or two clients and just started their journey because of the same passion that you have gone through. Uh, and they are just wondering, is this going to be the world that I'm going to be part of in this modern age?
Right.
What advice would you give to them to not to give up and ride through this journey, from your experience, a piece of advice, and say, these are the things you need to take care of, or do's or don'ts, who's just starting off new. Whether it,
I don't. Oof. It's hard right now.
yeah.
I think right now starting this industry is hard, and it wasn't long ago I actually met with was invited to meet with somebody who's looking to get into the business here in Arizona, and
Hmm.
wanted to pick my brain, right? Get suggestions and what do I need to do, and all those tactical things. Okay, audit readiness, operational readiness, get all these things are those are tactical things, and anybody, I could give you those tips, but that doesn't really mean anything. That's just technical things. Those are hard skills. But I think what you have to ultimately do, or at least my recommendation, is this has to be your calling. This has to be
Hmm.
your purpose. It is not hard, or it's not easy. It's hard work. And if it's not ultimately what you want to be doing as your sole purpose, you may not find the fulfillment because it's not going to get you the profits. So if you're getting into this business and you're going into it because you see this opportunity to get, this margin or this profit or this a boom market, this is the industry to get into, you're going to be disappointed. And you might be able to make some great fiscal maneuvers, but it's not going to necessarily fulfill you if you're going to the hard work. It's challenging. You have to do it for the people first. And the warning I have is also these are people's lives. Your primary product, right, is workforce. We're not making shirts. We're not making keychains. Your product are people. The people, your customer, our clients. You have two sets of all people. You can't treat it like a machine. You can't treat it like a supply chain factory or warehouse. I've known, I've experienced enough where you've got, my employee census is 1,000. Okay, well, how many are actually receiving a paycheck? Like, what's your warehousing ratio? Um, you have to approach it with the purpose for people, not the purpose of profiteering on a booming industry. I think that will set you up for failure. And ultimately, it will hurt a lot of the people that are trying to get into your organization because you're not in it for them. And so just because of who I am and I'm in it for the ultimate purpose first, that would be my biggest advice is make sure that you want to be in the people business and the people come first. And then if you do that, all the hard work is really worth it. You will not be disappointed. You will enjoy it. It will be fun. But if you don't do it for that reason, it may not be that much fun because it's going to be a lot of hard work.
Absolutely, absolutely. So well said, Sarah. I agree with you. You know, it's like you know, a restaurant owner, right? When you're a restaurant owner has to be a good chef by himself or herself, and then when he sees somebody eating his food, his delicacies, you know, the satisfaction, and then they just come back and say,
Yes,
"Oh, this was amazing." You know,
yes,
that's what is the return
that's the
of my hard work
reward.
of opening a restaurant.
Yes,
So it's the experience that you give to your human life
right.
in a different way by caring
Yes,
them is more important than, like you said, selling a piece
yes,
of cloth or selling a piece of
right.
keychain, an object which is non-living. Um,
Exactly.
that's a big part of the storytelling for opening a home care agency. This was amazing, fantastic experience. I know an up
Um,
close and personal conversation. Sarah, I know we never got the opportunity, but thanks for making time.
um,
It
glad
was
for it.
wonderful talking to you.